Hi, my name is Dr. Jamie Adam, and I teach pharmacology. All the time I hear my students say, pharmacology is so tough. How am I ever going to remember every single thing about the drugs that we learn? So, I made this video for them, and I hope it helps you too to figure out exactly what you need to know about different drug topics. So, today we're going to talk about insulin. And hopefully, by the end of this, you know exactly what is most important for you to know when it comes to insulin. So, you'll be ready for your next test, you'll be ready for NCLEX questions, and you'll feel confident going forward. So let's remind ourselves of what insulin is. Insulin is a hormone. This hormone is produced and secreted by the pancreas and specifically the beta cells. So I'm going to circle that here. Okay, the beta cells. And these beta cells release insulin in response to rising glucose levels or blood sugar. So when you eat a carb, your body begins to break that down into simple glucose sugar, and that signals to your body that it needs to also release insulin. So, one of the important things about insulin is that it really is the way glucose moves out of the blood and into the cells. If you think about it as a key, insulin is the key that allows that glucose to move into the cells, and the cells need the glucose for energy. So, without insulin, you have no way to get those cells energy. So, it's an essential hormone. Everyone has to have insulin to survive. Your body makes it naturally, but not everyone makes enough insulin, or their body, for some reason, is not producing enough insulin, or maybe not producing insulin at all because of some kind of secondary issue. So, we see this with type 1 diabetes. And also, with type 2 diabetes, you may have a situation where the patient isn't making enough insulin. So we're able to give insulin. So that's kind of going to lead into our discussion about insulin as a drug. But really, the whole goal with insulin is that we lower blood sugar to a normal level. And for the patient, the goal is between 80 to 110. So when we check their blood sugar and they're fasting, they haven't eaten or drank anything in the last several hours, we want to see that their blood sugar is between 80 and 110. And that tells us that their insulin is working correctly or that they have enough insulin in their body. So, insulin administration. Now, insulin can be given in a variety of ways, but most of the time it's given subcutaneously. So, you can see here in this picture, these are some insulin syringes. If you have given insulin in a hospital setting, then this is probably what the syringe looked like. It's a very recognizable orange tipped syringe, very small, dosed on by units because that's how we give insulin, by units. But here you see this is an insulin pump. So again, the medication is still going subcutaneously, but in this way it's automated. So this might be a patient that receives a little bit of insulin all through the day, and they receive it through their skin into the subcutaneous tissue, but they do it through a pump. And then here, this is a patient that is administering their own insulin through an insulin injectable pen. And so insulin can come that way. Again, it's going subcutaneously. But here, this is a little different. This is insulin IV. So insulin can be given subcutaneously or it can be given IV. In some cases, it can be given intranasal, and we'll talk about that a little bit, but that would be a less commonly used route for insulin. So, insulin is given sub-Q primarily, sometimes IV in emergency, but never given orally. And that is because insulin would be destroyed by the first pass effect. So, the liver would take that insulin, it would break it down, and there would be nothing left for the body. And so we don't administer insulin orally or by mouth, only sub-Q or IV, or in some cases, less often, intranasal. Okay, so now I'm going to take you through the different types of insulin. So this is rapid acting insulin types. We've got a Pedra here. This is a very quick acting insulin, the quickest acting insulin we have that we're able to give. Humalog and Novolog are also rapid acting. They don't work quite as fast as Apidra, but they also would be considered rapid acting insulin. And Novolog and Humalog don't have a lot of differences between them, but oftentimes a hospital will choose to use one brand over the other. And so you may have all of your patients on Humalog for rapid acting, or they may all be on Novolog. It just depends. But these are some examples of rapid acting insulin. Here is short acting. So short acting insulin example here would be Novolin R or Humulin R. Again, two different brands, but these insulins are virtually the same. So very, very similar, and they're recognizable by R. Sometimes this is called regular insulin. So you may have heard this called regular insulin, or you may have heard someone call it clear insulin. It's not the only insulin that's clear, but it is an insulin that we commonly mix with other types of insulin. So R or regular is short-acting insulin. These are going to work quickly, but not as quickly as rapid-acting insulins. Okay, next we have intermediate acting. So intermediate acting, we again have two brands, Novolin and Humulin, and what's recognizable about this insulin is that it's cloudy. So let's see, I don't think we can zoom in here, but you can see that the vial, the insulin that's in there is a cloudy white color. It's the only kind of insulin we have that's cloudy. So sometimes this is called cloudy insulin. It's also called NPH. So if you've ever heard of insulin called NPH, this is NPH insulin. So it's NPH, it's intermediate acting, it's cloudy insulin, and sometimes it's mixed with regular insulin or with rapid acting insulin. And then we have long-acting insulin. So this insulin takes longer to work, but then once it does, it has a longer action over time. So this is clear. And Levemir and Lantus are two brands that we use for long-acting insulin, but it has, again, this long effect. So each insulin I've shared with you as we've gone along, these are insulins that take a little bit longer to work and then have a longer action. So let's see this in a table. So here you can see the type of insulin, and we have the different names. We have rapid acting, short acting, intermediate acting, and long acting. And you can see the brands that are under those. And then if you look at the onset column, you can see how they vary. So rapid acting insulin takes about 15 minutes to start working, compared to short acting takes about 30 minutes to start working. Intermediate acting takes 2 to 4 hours just to start working and having an effect, and the same with long acting. So we have onset, peak, and duration. So the peak tells you when this drug is at its highest concentration in the blood. And then duration tells you how long that insulin has an effect in the body. Of all three columns, the column that is the most essential column that you need to know, this is the column that you have to memorize, this is the column that shows up on all of the test questions, is the peak column. So if you were looking at that table and you're thinking, how am I going to remember all this? Just know that the peak column, that is the most important column for you to memorize. So the peak tells you when that drug is at its highest concentration in the blood. And for insulin, the thing we worry about the most, the one thing that scares us the most about insulin, is that it can cause a risk of hypoglycemia. Its job, if you remember, is to lower blood sugar. So what happens if the blood sugar goes too low? What if that insulin is too effective and that blood sugar drops into a dangerous level? Did you know that you can die from hypoglycemia? Well, you can. You can die from hyperglycemia. So insulin is an essential hormone to life, and maintaining it at a normal level and a normal range is really, really important. So, from this table, memorize the peak. Know when is that patient most likely to have dangerous hypoglycemia. They're most likely to have that at the time where that insulin is at its highest concentration in the blood or the peak level. So, if you need help with figuring out how to study in nursing school, I want you to download my free ebook. The link to it is just below this video. Download it. I'm going to walk you through how to study in nursing school. It is not something you're born with. You don't just, it's not that some people are just naturally good and others aren't. It really has to do with strategy. And there are folks that have figured it out. That are doing just fine, but there are so many that are struggling. So I wanted to provide a resource for you. I want you to download that. It walks you through exactly how to study. A lot of the examples are from pharmacology because that's the course that I teach, and I know it will be helpful to you. So with that, I want to thank you for watching my video and invite you to subscribe so that you don't miss any other videos that can help you out in nursing school. I'm on Facebook and Instagram as well, and you can always email me if you have questions as well. So with that, I thank you so much, and I hope you have a wonderful time learning pharmacology. Bye-bye.